So I'm Jessica.
Hello, I'm Yadira.
And we're your IVF nurses here at Western Fertility. Today we're going to be going over a standard IVF calendar.
You're going to call us on day 1 of your period. You will begin birth control on either day 2 or 3. On this calendar, we have you start birth control on day 2 of your period. You'll be on active birth control for 5 to 10 days. In this calendar, it is 1, 2, 3, 4, 5, 6, 7, 8, 9. You will be on birth control so we can suppress your ovaries and control how your follicles grow. The day before we stop birth control, we will check your blood work to see if we can stop it. We are specifically looking at the estradiol to make sure it's low enough.
After you stop the birth control, 5 days later, 1, 2, 3, 4, 5, you'll start your stimulation medications. I call that day 1 of your IVF stimulation cycle. This can be a combination of injectable medication as well as oral medication. Some examples of these injectable medications would be Follistim, Menopur, Omnitrope, and some of the oral medications would be Clomid and Femara. Dr. Kumar assigns a protocol to each patient individually, so follow the protocol that was given for you. On day 3, 1, 2, 3, we have you come in for an ultrasound and blood work. So at that appointment and the appointments that follow, we are looking at your follicle sizes to trend how they're growing. And then we're looking at your hormone levels in your blood, specifically your estradiol and your LH, to make sure that the estradiol is rising appropriately. The LH is giving us an idea of how close you are to ovulating. So that'll let us know when we need to start a medication called ganirelix, if we need to start it. Ganirelix is a medication used to prevent early ovulation. We want to control your ovulation, in this case, to be closer to the egg retrieval. So you'll come in pretty much every other day during your IVF cycle. And a typical IVF cycle is usually about 10 days of stimulation medication. Your stim cycle can be longer than 10 days or it can be shorter than 10 days. It all just depends on your blood work and ultrasound results. Those will inform Dr. Kumar so that he can decide when is the best time to schedule your egg retrieval. So in this case, we're having an ultrasound on day 10 of the stimulation cycle. And at this time, we would also do what's called the egg retrieval setup. And so at that point, we would be discussing your instructions for your egg retrieval, such as when to take your trigger shots, when to show up for the egg retrieval, and other instructions as well. And so your egg retrieval in a standard IVF cycle is usually going to be day 11 or 12. It all is decided by Dr. Kumar based off the ultrasound and blood work results.
And that is your IVF calendar. Please remember that each calendar is different. It all depends on your case. Thanks for watching.